we have this process for it, my feedback from my coworkers, it goes, whatever the process was, they could say how employees were evaluated, but when asked what they were being evaluated around, it didn't have anything per se to do with the specific elements and activities of the model, whatever that model may be. And theoretically, if you wanted to operate, and I don't think it's a good idea, from an eclectic, quote-unquote, model of practice, you could still devise a means of evaluating, well, which ones are, which typically are the techniques that you're using. How well do you know them? They didn't even go that far. It was very bureaucratic, very bureaucratic. They also weren't tracking client outcomes unless the funding source required. But when they did, it was in aggregate. So you could never say that Roselyn gets better outcomes for this population versus that population. It was always just, as a whole, our clients seem to do X, Y, Z better, and they don't do better here. So there's nothing that further informs, create, enhance staff competence and confidence. Organization drivers. As you might imagine, the policies and procedures were highly bureaucratic and they were not model pertinent. Sometimes they collected process data, number of service hours, and as we dug deeper into this, part of the problem is the funding sources. If the funding sources would change and ask for something more specific, the organizations would also be forced to change because they're following the money. But if the funding source is only asking you, how many homeless people do you bring into shelter each night, and not asking any questions about what happens to them when they leave, how are you connecting them with other supports, then the organization was not tracking it. No data collected at all on any of the competency drivers, training, CEUs, any of that. Frequency of the ad hoc, risk containment supervision, no data being collected on that. Just very bureaucratic, keep the ship afloat kind of administration. System level interventions. This one, as you might imagine, was also left pretty much up to the individual practitioner. If there was an issue between Child Protective Services and the mental health service provider, they asked them to work it out on a relational basis between direct service providers, which may work for as long as those people are employed or in the situation changes, but it's not something that's going to change the way in which one system works with the other. The exception here, and it was a really shining star in all the findings, was that the Child Protective Services system had what they call family support teams, which theoretically all family members would be part of, along with the guardian ad litem's office representative, the Child Protective Services worker, any other providers who might be involved in working with that family. And what they determined was they were not getting fidelity to that. The idea behind that practice model was that if you have all those people present, and if you're seeking the guidance of the family on what they think they need and what they think is going to work, that you're going to have more individualized service. The reality was those meetings were basically run by the guardian ad litem's office, who would come in, and the guardian ad litem's office had volunteer lawyers working with them, and they would come in and they would say, this kid needs, this family needs, and if you looked at all the service plans, every family needed the same counseling, family therapy, individual therapy, psychological evaluation for the kid, a mentor for the kid, etc., etc. But every plan looked the same. So the administrators put their heads together and said, we've got to work between our systems. Guardian ad litem's have to understand what their role is in this, what the purpose is in this, and they actually began a series of meetings to sort out, system to system, how do we better support the intent of this practice model in child welfare. That was the shining star that we found. I should say that our students found. Data systems, not there. At most, aggregate population outcomes. Hospice programs tended to use satisfaction surveys. The satisfaction surveys were in no way used to then transform service delivery. Now, there's all kinds of problems with satisfaction surveys being used in that manner, of course. But at least if they were using that and applying it to try and improve service, then it was primarily documentation to support continued funding. Everything was around supporting continued funding. No data on model fidelity because they had such eclectic models, and definitely no efforts to gather any implementation data. So overall, lack of attention to implementation drivers and overall eclectic practice, quote unquote, is what they found. So they were organized to achieve exactly the kind of results they're getting. Not very good. That was the conclusion of our students. Any questions on that? Comments, concerns? Yeah?
Let me just stand so you can hear me. Oh, you made a comment about how, and I seem to understand where you're coming from, that a lot of what we heard or talked about yesterday is kind of irrelevant given what's actually going on in the field. And I just wondered if you could say a little more about what you were thinking about that maybe taking us in a direction where we're spending time talking about things and sort of missing what's really going on in the field.
Well, there's so many places to go with that. The nature of field instruction, something we were talking about in poster sessions last night. The fact that field instruction shapes so much of the development of MSW knowledge, skills, confidence, competencies, and yet this is what's out there. I don't think this is unusual. I do think Kansas City is a little bit behind. You know, kind of everything happens out on the left coast and the east coast and or down here on the Gulf Coast and works its way up and in. There are many things that Kansas City could be doing differently, these agencies. But if this is where our students are being placed and we're teaching them about evidence-based practice or we're teaching them about implementation frameworks, how's it getting reified, reinforced out in the field? It's not. It's a huge issue. Talk about the gap between research and practice. That's a significant area that I think we have to focus on. On the other hand, our students who went through this process of evaluating, and it happens every fall semester, they have to learn these frameworks, and it gives them a chance to apply their research skills that they've developed in their foundation year. They learn about what it takes to do a program well. And some of those students are now, eventually as they graduate, taking positions in the agencies in the area, and we're beginning to see, because each year we do this, we're beginning to see changes beginning to happen because those ideas are beginning to infiltrate the service systems. But that's a long, slow way of doing it. We should be doing it in a much more systematic manner. We shouldn't just rely on the educated MSW to change the agency. Yeah, we should, but I think our program has a responsibility, and I don't think we're doing a good job. Frankly, there are many other MSW programs also who contribute to the situation in the Kansas City area. That answer the question?
Yes, thank you.
Thank you for the question. It's a great one. Yeah.
My question kind of parallels kind of the answer that you just gave. But beyond just what we're trying to do for educating students right now, my colleague and I, we were noticing that what you were describing was perfectly depressing. Because what we see in the field, that's exactly the problem. And there really are no solutions that I see as of yet, which is why I'm interested in well, that's what's great about this conference so far. Because as a fairly young social work practitioner out there, the reality is that management, leadership, let's go from just public sector. We've talked a lot about public organizations, but let's look at private companies that we're working for. Oh, go do a group therapy. Okay, all right, I'll go do a group. It's not based on any specific idea or vision, but you have amazing social workers, and let's be honest, we influence a lot of decent LPCs out there as well. What I'm saying is that sometimes the best we've got, the best we can do, is Googling a really good pertinent topic to some of the people, some of the clients in the group that need that specific topic. It's not evidence-based, clearly, but still, that's the best we can do. So how can we translate even further from giving good social work students a more pertinent practice setting to what we're already having to deal with in the field?
I really think it's the responsibility of the MSW programs to create change relationships with the service systems where they're placing their students. They shouldn't, when we initially started these kinds of student evaluations and implementation, boy, is there pushback. You're going to look at what? You're going to make us look bad? No, we just want to understand how the program's organized, that's all. Gradually, we're working through that by doing it year after year after year, but I think it has to be much more active. I think field offices in MSW programs have a responsibility to upgrade, help upgrade the quality, whether through the faculty or bringing other people in, upgrade the quality of implementation, the clarity of practice model, just as we have a responsibility to work with funding organizations in the area and say, look, if you guys would just ask for this kind of information, they will organize themselves and deliver a better product. But if you're only asking them for how many have you served, that's all we're going to ever get. We're not going to really produce quality programs that use true evidence-based models. Yeah, sure.
But one of the ways in which we do that is through the way that we train field instructors, and that's one thing that we keep watering down. You know, I taught at Fordham, where Dr. Schwenk comes from, for 9 years as an adjunct, and field instructors went through a whole series of trainings, called CIFI, that lasted like 6 months, I think. Here in our program, it's like a one-day training, and now we're thinking about going to a virtual training so that field instructors don't even have to come into the university. About the watering down of the training of field instructors.
I think that's typically the model that's used. You know, the instructors come in for field day, and then there's CEUs provided, et cetera, et cetera. It's a nice relationship building activity, and a few things can be learned, but that's very different than working with the agency administrators and saying, look, we'd like to help you better clarify what your practice model is, and then help you think through some of these implementation drivers so that you might be able to keep your staff longer, because staff who are confident and competent, yeah, pay is important, workload's important, but if you feel confident and confident, you're going to stick around longer. We don't do a good enough job of selling that as MSW programs to our field sites, and I think we have a responsibility to do that. We now have frameworks for doing it. Let's go out and do it. Let's change what we're doing. I don't want to totally depress you. I mean, that's what's happening in Kansas City. Yeah, I think it's probably happening in most communities. But we made some changes here in Houston, and unless there's another question or comment, this is another way the frameworks can be used. How many here know what wraparound is? Oh, good. So I may just spend much time on that. Good. This is the Systems of Hope grant site. They had a 6-year, multi-million-dollar Samson Children Mental Health Initiative grant, Systems of Care grant, it's often called. And they were trying to do wraparound for a number of reasons, as you'll see in a second. They felt that they were not having the fidelity of implementation that they wanted, and they invited me to come down and do some work with them. And here's what we found, how we found it, and how we changed it by thinking through implementation frameworks. So wraparounds, one of the problems it's got is that from its inception and in a reaction to expert model of practice, they wanted to do collaborative work on use, family-driven, youth-guided, culturally competent, using natural supports, individualized care plans, team-based work, community-based work, persistence. If the plan doesn't work, you change the plan, you don't kick a kid from one system to another, et cetera, et cetera. All of this was articulated as values, value-based principles. Problem with that is that people hear those principles and interpret them through their own previous experience and training. And so you're going to get model drift.